Good evening, students. Today we'll be discussing about ciliary ganglion. So this is one of the four parasympathetic ganglia. So total there are four parasympathetic ganglia in the head neck region. So which are lying on the uh, course of the trigeminal nerve and its branches. So they are topographically related to one or the other branch of the trigeminal nerve, but functionally related to other ganglia. So they are namely the ciliary ganglion, pterygopalatine ganglion, otic ganglion, and submandibular ganglion. So today we'll be dealing with the ciliary ganglion. This is topographically related to nasociliary nerve and functionally related to oculomotor nerve. So size is pinhead size. So it has multipolar neurons. It is located at the apex of orbit between optic nerve and lateral rectus muscle. So you can see it is having three roots. So this small communicating branch from the nasociliary nerve forms the sensory root, and this is a sympathetic root which is derived from plexus around internal carotid artery, and this is the parasympathetic root which comes from Edinger-Westphal nucleus. Then it passes through oculomotor nerve, inferior division of oculomotor nerve, branch to inferior oblique, and this is a communication branch coming from the branch to inferior oblique to the ciliary ganglion. So if we see, the sensory root is not relaying in the ganglion and sympathetic root is also not relaying in the ganglion, only the parasympathetic root is relaying. From there the second order neurons are going. So all these roots are passing through the short ciliary nerves, which goes and supplies the sphincter pupillae muscle and ciliaris muscle. So connections, motor root or the parasympathetic root derived from nerve to inferior oblique. So pathway is, it starts from preganglionic fibers, comes from Edinger-Westphal nucleus, then they pass through the oculomotor nerve and its inferior division and branch to inferior oblique and communicating branch to ciliary ganglion. There is relay in the ganglion. Postganglionic fibers pass through short ciliary nerves and they supply sphincter pupillae and ciliaris muscle. Majority of them goes to ciliaris muscle. Sensory root derived from nasociliary nerve, so they carry pain, touch and temperature of the eyeball. And sympathetic root, postganglionic fibers from superior cervical sympathetic ganglion, so they does not relay in ciliary ganglion. So derived as a branch from plexus around internal carotid artery. They supply dilator pupillae muscle. So branches, there are 8 to 10 short ciliary nerves. So parasympathetic and sympathetic and sensory all will pass through these short ciliary nerves. They, after reaching close to the eyeball, they further divide and form 15 to 20 branches, and they pass between the sclera and choroid and reach the ciliaris muscle, sphincter pupillae muscle and dilator pupillae muscle and supply them. Thank you.